So I will begin now. So hi everyone, and thank you for joining our webinar today. My name is Rosie and I'm an examinations contractor here at the Ophthalmology Foundation. Just as a little overview, the Ophthalmology Foundation has been in operation for just over 5 years now, and its mission is to eradicate blindness through the world through education, especially in under-resourced countries. In doing this, there's multiple programs that the Ophthalmology Foundation offers in mentorship and education, and then most recently our examinations program that we're going to speak to you about today, as well as our fellowships program with Cordula. The Ophthalmology Foundation is very much a global country. We have a board of directors made up of members throughout the world, and then our examinations committee that is, again, just dedicated towards our exams and made up of members globally. So just before we begin, if everyone would like to introduce themselves. So Nicola, if you would like to first introduce yourself.
Thank you, Rosie. My name is Nicola Quilter and I'm the Examinations Director for the Ophthalmology Foundation.
Thank you. And Cordula?
So hello, everybody. My name is Cordula Gabel-Obermeier from Munich, Germany, and I am in charge of the EOFF-OF Fellowships Program. Welcome, everybody.
Thank you. And Essam?
Yes, I'm Dr. Essam El-Touki. I'm a board member in the Ophthalmological Foundation, as well as the chairman of the Egyptian Ophthalmology Board and the vice chairman of the Arab Ophthalmology Board. And that's all.
Thank you. And then Vicky.
Hello, my name is Vicky and I'm an examinations administrator for the Ophthalmology Foundation.
Thank you. Just before we get to Nicola's presentation, Dr. Essam, I understand that you wanted to say a few words just before we begin.
Yes, please. I just want to tell you that during my whole experience in ophthalmology, which is almost 40 years now, and most of it was dedicated not just to clinical practice, but to education. And I've seen some of the names. I'm sure they know and that they understand about this. That's a great opportunity. It's a great initiative in the ophthalmology world everywhere globally by providing curriculum development, by providing standardized education and training, by providing opportunities for doctors, ophthalmologists from underserved and countries and under-resourced countries. That's a big initiative that I urge you to make use of it. The Ophthalmology Foundation is now in conjunction with many institutes, as you will see in the presentation, the whole Middle East, many countries, East Africa, the COESCA, the UK, England, Germany. So it's a big opportunity that I really urge you to use it. We'll always be there to support administratively and clinically and educationally. Good luck, and we're here for you.
Thank you very much, Essam. Thank you. I'll now hand proceedings over to Nicola, who has a presentation about our exams to share.
Excellent. Thank you, Essam, for your words today. It's great to have you on board. And good day to everyone. Thank you for joining us. Today, I'm pleased to introduce the Ophthalmology Foundation International Examinations, which are internationally standardized assessments designed to support excellence, consistency, and fairness in ophthalmology worldwide. The examinations are delivered across the world, allowing candidates from many regions to access the same high-quality assessments. Wherever a candidate trains and practices, the standard remains exactly the same. At the heart, these online exams assess knowledge across the full breadth of ophthalmology. They provide a reliable and meaningful way to benchmark performance locally, nationally, and internationally. The fees are based on the World Bank Index, meaning they are low cost compared to any other international examination currently out there. And there is a 3-way and a 6-way payment plan to also support candidates' application. And this means that you can go on and pay in installments. So if you choose and opt to do the 3-month payment, then you can pay over 3 months, and the cost of the exam will be spread out equally between the 3-month period. Next slide, please. Examinations are aligned to the BCSE. Alignment is to the international standard. All questions are mapped to the American Academy of Ophthalmology, and it covers the full breadth of ophthalmology training. This ensures consistency, relevance, and global comparability, and regularly reviewed, updated in line with the BCSE and development. So you'll always get an up-to-date exam relevant to the ophthalmic education currently available. Oversight of the exams is provided by an experienced international executive committee. This ensures strong governance, academic integrity, and continuous review. As you can see from the list, our chair, Louis Amaya, he's based in the UK, but is actually originally from Colombia. We have Richard and Rebecca that are responsible for 2 of the papers. And then we have a wide spread of senior ophthalmologists. Carl Golnick is from the Ophthalmology Foundation, who is on education. We have Berthold Seitz, who's head of the fellowship program. And then Essam has joined us today, has joined not only our exams committee, but also our Ophthalmology Foundation board. The examinations framework is carefully structured into 3 sections, and together these reflect the progression from scientific foundations through optics to comprehensive clinical practice. Next slide. So 3 exams, the first one being visual sciences. It's 120 single best answer questions over a 3-hour period. It covers anatomy through genetics, pharmacology, and ophthalmic pathology. An example of one of the questions for visual sciences is shown here. And what I'd like to say is that we're not testing your language, we're testing your ophthalmic knowledge. So you will see that the question style is quite repetitive. So the Ophthalmology Foundation choose to use an example for regarding the blood-retina barrier, which one, meaning we're looking for one correct answer, of the following statements is most likely to be true. So we're looking for one correct answer. Each question has 4 stems, and you will see from A to D that they're alphabetically aligned. This means that if you are unsure of the question and you move forward, when you come back and you remember which one you thought it was, it's very easy to pick out in the 4 that are presented to you. Next question, slide, please. Next exam is optics and refraction and instruments. There are 60 single best answer questions over an hour-and-a-half period. And the subjects cover optics, refraction, and instruments, and all are equally weighted with 20 questions. Example of the question. So again, which one? So we're looking for one correct answer. Of the following is the orientation of the streak of light when performing retinoscopy for astigmatism. Again, you will see that there are 4 answers, potential answers, all alphabetical, with 1 being correct. Again, we are not testing English language, we're testing your knowledge of ophthalmology. Our next exam is clinical ophthalmology, which is slightly longer than any of the first 2. It's 160 single best answer questions over a 4-hour period. It's spanning all major ophthalmic subjects, including neuro-ophthalmology, glaucoma, retina, and also including community and public health and general medicine related to ophthalmology. Because this exam is online, it does allow us to use very good clinical scenarios with good photos, graphs, charts, and sometimes videos. I think there's a question with really, eye movement on, etc. So you'll find these questions in this paper are more clinical, giving you a scenario. But again, we do use the most appropriate area to evaluate of MRI scanning is which one. Again, we're looking for one correct answer of the following. Again, A to D, as you will see, alphabetical. To further support accessibility, the Ophthalmology Foundations are translated into several languages, and these include Chinese, French, Portuguese, Spanish, and more recently, Vietnamese. What we want you to do is practice for the examination. So we have practice questions that are available via the website. We have suggested reading lists aligned to examination content, access to high quality educational material via the website. And we're also pleased to say that we're working with CyberSight, which is part of Orbis, in providing a dedicated portal that is linked to the Ophthalmology Foundation exams and mapped to the BCSE. So we're currently working with Orbis, with CyberSight on this, and we have just completed retina and glaucoma. So within the next couple of weeks via the website, you'll be able to access the portal. There'll be about 250 questions for each of those subjects, which are designed to help you prepare for an exam. And I will say that also, if you're preparing for your local exams, they're also a good prep tool. They're free of charge to help you prepare locally for your local exams as well. Candidates who've already demonstrated competency through recognised international examinations may also be granted exemption from the OF Visual and Optics exam. At the moment, we consider the International Council of Ophthalmology exams passed in or before 2022, the COEXA exams, as we're working in collaboration with COEXA, and also the Royal College examinations, and that includes Edinburgh, the UK College, and also Glasgow. And we are currently in discussions with Glasgow, which I'll speak about in a moment, regarding reciprocity. As I mentioned, we translate the exams into Chinese, English, French, Portuguese, Spanish, and Vietnamese. And when you're online, this translation is simultaneous. So everything will present in English. However, if you've selected French, maybe then it will be able to click on a button and it will translate into French for you. So there's no having to look through different papers or moving to a different screen. It was all presented in one screen in front of you. Next slide, please. Okay, thank you. All examination questions are written by international subject experts, and each question undergoes meticulous review to ensure clarity, relevance, and consistency. Each question actually goes through a process of about 20 to 30 specialists checking each question. And they're regularly reviewed and updated and high academic and clinical relevance. And even if they're used in a paper, for example, 1 year, we will review the question, we'll modify the question and possibly use it in a future paper, but it will not quite the same. The examinations are criterion reference and standardized using the Angoff method. This supports fairness, enables meaningful comparison of outcomes across regions and institutes. The Angoff standard method is used globally, and what that does is it takes a pool of senior experts to review each question and give it a value, which will then derive our pass mark from. Development is strengthened through collaboration with leading international institutes. We currently work with Wills Eye Hospital and Wilmot Eye Institute, and we developed in partnership with leading other eye institutes aligned with basic and clinical standards. And we're looking at, always looking for new partners to sign MOUs with to work together. And we've recently just signed an MOU with the Egyptian Society and also the Arab Board. Excuse me. Delivery is modern, secure, and reliable. And they're online exams, in-person invigilation, and also remote AI monitoring. They're secure, reliable, and it's a really secure platform. And what we like is that there is a two-mode invigilation. So AI monitoring looks at eye movements, noise background, and then also we have a senior ophthalmologist present at exam day. Exam sessions are held twice a year in March and September, and results are released promptly within 2 weeks of the exam date. And dedicating Vicky and Rosie have been amazing and have been able to get the results out in less than a week. I think it was actually 6-7 days for the last March sitting. So it's a credit to them. And we know that it's, it can be quite stressful. People are worrying about how they've done, how they've performed, if they're successful. So the results are actually notified by email within the 2-week period, but so far we have been able to do that within a week. So why should I take the exam? The examinations provide an internationally recognised certification. They offer a cost-effective way to demonstrate your knowledge and benchmark your performance against a global set of peers. Candidates are awarded the FIOF, so you become a fellow of the International Ophthalmology Foundation, and you receive a really nice certificate, embossed, hologram, etc., that you can display with proudness. And you also gain points currently towards an IOF fellowship. In turn, we believe that achieving this pass enhances the quality of patient care worldwide. And we also offer an award and recognition for the top passing candidate of the clinical exam. The clinical exam from March and September, we look at the top passing between the two of those, and the award is $10,000 grant from the David and Molly Pyatt Award. And you can use this to attend global conferences, specialized training programs. And I was lucky enough to be able to make the call to the awardee last year, and he was from Ethiopia, taking his exam in Rwanda. And I believe he's using his to support him through a 1-year fellowship and possibly attend the American Academy of Ophthalmology. So it's really worth, really you're studying hard, really trying to aim for the top. And it's the top passing candidate of both exams, both clinical exams, within the 1-year period. And we have a lot of positive feedback from our candidates, and this is just a few that I will show you. But candidates are consistently describing the examinations as fair, clinically relevant, and very well delivered. We also have Testimonial Tuesday, which is on our social media, so you'll see more testimonies there, and you can also find them on our website. Many highlight the clarity of the questions and the reliability of the platform. As I said, if you're choosing to take it in a language, you can simultaneously move between English and the chosen language. And many of them are saying it's a smooth experience from start to finish. And this means that you apply through the online portal. You will then upload your photos, submit your current certificates, proof of your application. You can make payments, even using the 3-way and the 6-way payment system. And then your results will actually be uploaded to your portal, and then you can apply for the next exam if required. So it is a very smooth process. The examinations, as I said, are criterion reference and standard using the Angoff method. So we're going to use the same method when we're introducing subspecialty exams. And we are introducing those in retina and glaucoma for March 2027. These exam papers will be 120 single best answer questions over a 3-hour period, and are available through two different pathways. One, if you have been successful in our clinical exam, and 2, if you're already in clinical practice as a senior ophthalmologist, and you have evidence of at least a year's practice within that subspecialty, then we will consider you being able to apply for them. Application process will open in August, and there'll be further information soon on the website. We're also talking with the Royal College of Physicians and Surgeons of Glasgow, and we have agreed that we will be moving forward with a reciprocal agreement, which means if you are successful in our visual and optics, you'll be able to move through to their part 1. And if you are successful in our clinical, then you'll be able to move through to their clinical element. This is not on the website at the moment, but we are in the final point of discussion with regards to that. And we hope to have that signed and delivered by the middle of June. So please look out on our website for more. But what it does mean is that you'll be able to take our exams and move through their system towards membership. And then the third development is the Ophthalmology Foundation and IOF fellowships. Cordula, I'm sure we'll talk more about that in a moment, but it will be a prerequisite that to move forward with a fellowship application, you will have to have passed at least our visual examination to be able to make an application. This is my last slide. It will give you a QR code which you can scan to get further information. It also shows you our social media. We're always posting on social media. our new developments, future programs, etc. So please keep a lookout on there and join our social platforms. And I think the last thing to say is we are modern. We are online. You do not have to travel far from your hometown to access these examinations. And in turn, what that means is that they are affordable. You don't have to, pay for a flight or pay for accommodation, have the stress of traveling. It's efficient. As I said, you can go online, make your application, make a staggered payment, and then also get your results. And as I said, it is affordable. So we understand this is an additional cost to maybe your standard exams that you take within your normal practice and your normal system, but it is affordable. They're based on the World Bank Index, so we are lowering fees for different regions to make it more affordable, and we have implemented a payment system where you can spread the cost. So if you have any questions, there's a Q&A at the end of this hour, and we'll be happy to answer any questions. But then if you go away and you think of something and think, oh, I wish I'd asked that, then please don't hesitate to reach out. We are here to support you. Thank you for your time today.
Thank you very much for that, Nicola. Just before we move to Cordula for her presentation, I can see a couple of questions have come through in the Q&A box. So just to reiterate, if you do have any questions throughout the course of this webinar, please feel free to drop them in the box below and we will get to them in our Q&A session at the end. I'm going to hand things over to you now, Cordula, if you could please share your presentation with everyone. Thank you.
Thank you, Rosie. Thank you for introducing me. Please allow me to open my presentation. So my name is Cordula Gabel-Obermeier. As I said before, I am in charge of the fellowship program. So what is the EOFF-OF Subspecialty Fellowship Program about? So EOFF stands for International Ophthalmological Fellowship Foundation. We are a German charity that was founded in 2007. We're committed to enhancing eye care, education, and delivery in low-resource and underserved countries. Our program invites highly motivated young ophthalmologists to apply for a 3 months, a 6 months, or a 1-year EOFF-OF subspecialty fellowship, which then can be served at an international teaching center. These are mainly university eye clinics or tertiary centers abroad from where the candidate lives. Immediately after having completed the EOFF-OF subspecialty fellowship, our candidates are committed to return to their home country. They resume their position and take part in programs to preserve and prevent blindness, preserve vision and prevent blindness, sorry. Generally speaking, our trainings are classified as observerships. This is because of local or national regulations from the Ministry of Health in the host countries. But there are exceptions in regard to cataract surgery, glaucoma, and oculoplastic. So we're happy to tell you that our hosts in India, some hosts in Bangladesh, and some hosts in China are actually can allow surgical exposure to our candidates. The educational level in subspecialty training through the countries is very different. So our aim is we want to raise everybody's standard from his or her level of expertise to a higher level of expertise. So this is why we are not offering a degree and there is no curriculum that needs to be followed. Our program actually aims at individually supporting personal skills and eye care with a focus on challenges in the daily work. So these are the fellowship opportunities that we're offering. So we have the regular one, that is the 3 months fellowships with around 100 awards per year, and with a stipend that amounts to 5,000 euros to 6,500 US dollars. This actually depends on who sponsor is. Then we have the 6 months fellowship in collaboration with the Eye Cancer Foundation. These are maximum 6 awards per year with a stipend amounting to 8,000 US dollars. We have the 1-year fellowship in collaboration with the Retina Research Foundation. It's available in all subspecialties. and where we can support 2 awards per year with a stipend of $35,000. In collaboration with the Academia Ophthalmologica Internationalis, we offer a 1-year research fellowship. It's 1 award per year, and it goes with a stipend of 12,000 euros. The stipend is just for the awardee to cover round-trip travel expenses, miscellaneous expenses, and student-style living. So our host centers actually do not charge for tutorial and administration. So on this slide, you can see where we have host centers. Currently we're collaborating with 103 host centers in 30 countries all around the world. And on this slide, you can see the international awareness of our program. So the countries that are marked in red, like the United States, these are host countries. The yellow ones are countries where our candidates come from. And the countries that are black and red, that are so-called hybrid countries. These are countries where we're actually having candidates from, but that also have host centers. Where do our candidates come from? Where do they train? Excuse me. So a good number of our 420 fellows in the last 4 years actually trained in India. This is because, as I mentioned before, due to the fact that they can undergo surgical training in cataract, glaucoma, and oculoplastics, then United States is place number 2. Then we have Germany. I think since we are a German organization and we have a strong German host list in our directory, we are happy to have a lot of fellows from all countries. And United Kingdom also, that goes without saying, is a very important country for us. What are the favorite subspecialties? Actually, it is cataract surgery, glaucoma, pediatric, cornea and external diseases, oculoplastic, vitreoretina, and medical retina. But also the other subspecialties are being offered and are important. Please note that we are not supporting refractive surgery in cornea subspecialty, as well as we are not supporting aesthetic surgery in oculoplastic subspecialty. What is the application process? This is about eligibility first. So we are looking for candidates who hold nationality of and are permanently based in a low resource or underserved country. Ideally, our candidates are 40 years of age at the time of submitting the application. They have completed a residency training. They have obtained a specialist in ophthalmology degree. They come with a strong recommendation from previous and present chair, and ideally they hold a public services or a teaching position. As mentioned before, our candidates are committed to resume their position after the training to apply the newly acquired skills and knowledge for the sake of their patients and to teach their colleagues, of course. Our candidates come with a very clear idea of what aspects in a subspecialty they wish to focus on. For example, it is not possible to learn all about vitreoretina, but if somebody has a challenge and recurrent challenge in a subspecialty, then this is something the candidate can discuss with the preceptor and deal with that. As mentioned before, the Ophthalmology Foundation exams find strong consideration in the assessment for the fellowships program. So currently we give maximum 8 out of 35 points for having taken the Ophthalmology Foundation examination. And the OF exams are mandatory requirement from September 2027 onwards. I see there is a hand, but maybe we can deal with this hand afterwards. Rosie, is that okay? Yeah?
Yep, that's all right. Thank you, Cordula.
Oh, thank you. Okay, so what's the application process? I would say it's pretty simple. You can gather information on the program from our website, and then you'll find an online registration form. Please fill it in and upload the requested documents. requested documents actually are a scan of the passport, a picture portrait in high resolution, specialist degree, and it's a certified translation into English, and 2 recommendation letters from present and from previous chair. There are questions regarding the candidate's motivation, expectations, and impacts that the candidate wishes to gain. That is a very crucial part in the application file, because since we do not have a curriculum, we are looking for candidates who have a clear idea of what they want to learn. Then submission for eligibility determination. If everything's all right, I will return a so-called application summary to the candidate and allow the candidate to choose and contact the favorite host from the EOFF host network. On the right side, you can see how the network looks like. It is searchable by country, by subspecialty, by clinic, by preceptor, and by duration. Many of our hosts actually want to run a short interview with the candidate to find out if what the candidate wants to learn can be done. And then the host has got 2 weeks to decide if he or she wants to support the candidate. And then candidate will agree on a proposed start date and will submit the duly signed host notice of acceptance form to our office so that we can process the application files for experts review and funding decision. So next application deadlines actually are July 31st and January 31st, 2027. And I want to repeat it because it is so important. We consider the Ophthalmology Foundation examinations, and we certainly recommend you to pass them. Again, here on our website, there is a section where we recognize those who have already taken the Ophthalmology Foundation examinations. And I think it is, it's a very nice benefit for everybody if his or her name appears on our website. Also, we are very happy to congratulate Dr. Gebre Kiedan from Ethiopia or Rwanda, who has been awarded the prestigious David and Molly Foundation Travel Grant for the highest passing score in the clinical ophthalmology examination in 2025. So, it's always good to have the statistics and to have some basic information, but it's always nice to read through some experience reports, which you can find on our website. And I have taken out a few of them. So here, for example, it was a young doctor from Ethiopia who served in an observership in Vitretina at the University of Colorado at the Anschutz Eye Center under supervision of Professor Scott Oliver. Or here are 2 young ophthalmologists from Ukraine who underwent an observership in Vitretina at the University of Lublin in Poland under supervision of Professor Rejdak. Here is a young lady from Mexico. She served an observership in cornea and external diseases under supervision of Professor Bachmann at the University of Cologne in Germany. And also she recommends you to go through the process. Last is the gentleman to the left, that is Dr. Mangan from Turkey. He served ocular oncology under supervision of Professor Bechrakis at the University of Essen in Germany. And also he was very happy to have chosen our fellowship program. So where do we get our funding from? Funding comes from national and international ophthalmic societies. It comes from German and international ophthalmic industry. And also we are having a good amount of funding from German and international sponsors. So if you wish to have more information about the program, here's our website. You can find the fellows' experiences in one of the under pages, as well as the EOFF host network. And if you've got any questions that have not been answered through my talk, then please feel free to reach out and I'll be happy to answer them. Thank you very much for your attention. So I'm giving back to Rosie. Thank you, Rosie.
Thank you very much, Cordula. That was great.
You're
Um,
welcome.
we're now going to move on to the Q&A session, so I believe there probably will be a couple for you in there as well, if you don't mind answering some questions.
Of course I do.
Vicky, if you don't mind kickstarting the Q&A session, thank you.
Thank you, Rosie. First question is, are there any available test centres in the US?
We do have two centres
Nicola.
in the USA. However, this is not predominantly our market in that region. So if you are based in the US, you might be visiting or coming out of fellowship, etc., then please let us know, and we will do our best to accommodate you as close to your location as possible, which we have done in the past.
Thank you. The next question we have is the exam only administered in designated test centres, or can it be administered online at a candidate's personal device at home?
And that's a good question. We had a lot of discussion when we were setting up the exams as to what the invigilation process and system should look like. We do have a fantastic AI system built into the program. It looks at eye movement, mouse movement on screen, noise in the background. But we are a high stakes exam, and we like to have an additional layer of security. And so at present, we have the AI system that's built in, but we also have a human proctor, an invigilator. So you will have to go to a centre and that we have organised. You can't just take it at home. So that there is a double layer of security. However, as we said, hopefully you won't have to travel far. If you can't find an exam centre in your location, then please let us know, and we will do our best to find one that is close to you.
Thank you. Question for Cordula. Will the 40-year-old cap for the fellowship application be extended in the near future?
So actually, we are discussing this from time to time, but at the moment, I can tell you that we are a little bit flexible when it comes to the age limit of 40 years of age at the time of submitting the application, as we are looking for really good and rewarding and candidates whose training would be very rewarding for their community and host institute. And we're not only looking for candidates who are actually under 40 at the time of the application. So if a training is considered to be really relevant and the candidate is very rewarding, then we are happy to accept applications from candidates who are a little above 40 years at the age of submitting the application. Yeah, thank you.
Thank you, Cordula. The next question is for Nicola. If I pass the ICO basic and clinical exams before 2022, will I qualify as an IFOF nomination? I think it means FIOF.
Yes, so we do offer exemptions. So if you've been successful in the ICO exams prior to and including 2022 for visual and optics, then you can move directly on to our clinical exam. Once successful in our clinical exam, you will be awarded FIOF, which is the Fellow of the International Ophthalmology Foundation. So yes, you will get an FIOF qualification if you have passed visual and optics in ICO and the Ophthalmology Foundation clinical.
Thank you very much. The next question is, does the OF certificate expire?
No, there's no expiration date on the certificate. You will get a nice certificate that you can, high quality paper. It's signed by the president and the chair of exams. It's embossed. It's got a hologram on. It's really nice, and you should be really proud of yourself once you've received a certificate from the Ophthalmology Foundation. And display it. Be proud that you've achieved it. But there's no expiration date on those.
Thank you. So the next question is from a candidate that we've had dealings with before. They say, I'm currently in Eswatini. I was wondering if you could find me a centre here.
Sure, if you just email one of us, probably Vicky would be ideal to email for that one, and then say that you'd like to take the exam, and then you have to make an application online for the exams. We know that you're serious about moving forward, and we will then find you an exam centre close to your location.
Thank you. The next question is, hi, I was wondering why the year of the ICO examination must be before 2022. I undertook the exam in 2024. At the time, there were no OF examinations available.
Yeah, we totally understand that, and unfortunately, it's an unfortunate situation. So the reason why we don't accept ICO after 2022 is that we are unsure of the standard of the exams for ICO. The Ophthalmology Foundation exams are of an exceptionally high standard, and we are recognising that now with the Royal College of Physicians and Surgeons of Glasgow, where we're going to have a mutual agreement, a reciprocal agreement on examinations, allowing you to move through both systems. Because we are unsure of the standard of the ICO since 2022, we're unable to say that they are at the same standard as the Ophthalmology Foundation exams, and therefore we can't guarantee that they are, and therefore are unable to allow trainees to move through after 2022. If you've got other certificates that would support your standard, then please feel free to email us, and we can review that. But if you haven't passed before 2022, you will have to take the OF visual and optics exams.
Thank you. The next question is, if I pass the clinical ICO exam, will I automatically qualify to become an FIOF?
No, unfortunately, you will need to take the clinical ophthalmology with the Ophthalmology Foundation to qualify for FIOF.
Thank you. The next question is for Cordula.
Yeah.
Should I find a hospital or professor for fellowship, or is there a list I can choose from?
Oh, so actually on our website there is the EOFF host directory, and it is searchable by hospital, by country, by subspecialty, or even by preceptor's name. And I would like to invite you to check it. If you can't find your favorite hospital on that list, you may send us an email to info@eoff.org or cgo@eoff.org with the hospital's name, sorry, with the URL, with the email address of the potential preceptor or the chairperson, name of the chairperson, and very important, with your reasons why you would like to serve a fellowship at that particular institution, and then we can review it and and let you know.
Thank you, Cordula. The next question for you again, Cordula, is, will IELTS points or master's degree be an advantage for matching the fellowship program?
So actually, thank you, Vicky. Actually, it is it is absolutely necessary that the person who goes to a specific host center speaks the language of the training center there. So it is a personal advantage, yes, of course, if one has got the IELTS or the master's degree in English. And yes, that is what I would say. It is not necessary exactly to be fluent in the language spoken at the host center. For example, it's not necessary to be fluent in German to go to Germany, as the language in medicine and as all our doctors and usually medical staff is well capable of speaking English. But of course, it's a little bit of an advantage in your daily life in the streets if you can speak a little German if you're in Germany. And that applies to all countries, I'd say.
Thank you, Cordula.
You're welcome.
The next question for Nicola is it the subspecialty exam? Do you need to have completed the OF exams prior?
So there will be two pathways, I think, and there'll be one that you have completed the clinical ophthalmology exam and you move through, in which case, if you took glaucoma, for example, and you have the clinical exam, you'll be awarded FIOF brackets glaucoma, and your certificate will represent that. But otherwise, there will be another pathway where if you've gone through all of your exams, we're not asking you to go back and retake them and go back. If you're in clinical practice for the last 5 years as an senior ophthalmologist, we're not going to make you go back and take the clinical exam. You will show us evidence that you have been working in glaucoma for at least a year and a half, and we will evaluate that, and then you can apply that way. However, you will get a certificate that says that you are competent in glaucoma, for example, and will not be able to use the post-nominal FIOF. So there are two pathways through that, and I think that's important because, as I say, we're not making you go back and take your exams again. If you've been in clinical practice for a period of time, then you should be able to move through the subspecialty program. And another question we've had previously, which no one's touched on, you can take more than one subspecialty exam if you wanted to. Someone's inquired last week about taking retina and glaucoma. And if that's what you want to do and collect the subspecialty exams, then by all means, feel free to do so.
Thank you very much. The next question is, what duration do you suggest for preparing for the exam if they haven't taken any exams before?
So we recommend that you take the visual and optics in your first, second year, and the clinical in your third and fourth year. Preparation time, I think you should give yourself at least 2 months, so 8 weeks of proper preparation. But again, I think you need to be realistic in the fact, if you've got other commitments, other local exams, a family, etc., which everybody, all these things come into play when you're preparing. Do you think you have enough time, enough prep time to be able to give yourself the best possible chance of succeeding? And that's realistic from our point of view. We want you to pass, and that's why we make sure that you have the material available online. We're working with Orbis to give you the best possible, preparation questions to make you help you succeed. So I think you need to, be realistic, make sure that you have enough time aside, that you can, put time aside to prepare for the exams. And, I think 2 months, when you're going to take it, then I think 2 months prior, it gives you enough time, 8 weeks to prepare for something like the visual sciences.
Thank you very much. The next question is, will the OF examination help in relation to ICO pathways and FRCS?
We don't have any reciprocal agreement with the International Council of Ophthalmology. We do accept their qualification up until 2022, as I said, because we know that's the standard up until that date. Thereafter, we are unsure, so we will not accept that. And with regards to moving through something like Glasgow, we are working with the Royal College of Physicians and Surgeons of Glasgow. And I think in the second week of June, we hope to announce our collaboration. And it should be that you are able to move through both pathways, the Ophthalmology Foundation and the Glasgow, which will allow you to move on to membership of Glasgow, which is actually really exciting. Our exams are low cost. You can spread the payment, you can take it in your own country. We will find you a centre, which also means you don't have any additional costs of staying in a hotel, travel, etc. You don't have any, anxiety and stress before the exam of getting to the location because it's close to you. So I think there are lots of benefits of, collaboration and, taking our exam, which allows you to move through Glasgow's, system, for example. So yes, there are benefits, but not with the ICO.
Thank you very much. Next question is, if I'm away from home, from my home country, can I take the exam in another country?
Yes, of course. Yeah, you will need to prove that you are in that country for a reason. We can't just allow you to and give you, a letter to say that you're taking an exam there. You will have to be in the country for a reason, fellowship, holiday at the time, work commitment, etc. And then by all means, you can take the exam in a different country.
Thank you. The last question we have is, if one fails, is there an option of retaking?
Yes, if you are unsuccessful, and we hope that you're not, our main aim is to give you all of the material that will enable you to prepare and be successful. We want you to pass first time, but for those that don't, you can retake. And there are many trainees and candidates that come through and say, I wasn't successful, and they're 1 or 2 short of the pass mark, which is unfortunate, and they're really close. And a lot of those trainees opt to take it in the next sitting. But yes, there's no limit on the amount of times you can take it, and you can resit.
Thank you. This is my own personal comment. Nicola, could you just explain to everybody where they can find the suggested reading lists, the example questions, etc., for revision?
Yeah, sure. So if you go onto the OF website, there is a suggested reading list, which has suggestions of free material, websites. There's a good video for goniotomy on there. That's on the website. And we also have now introduced several practice questions, which you can go on. They cover subjects in visual optics and clinical. You can select what you think is the correct answer, and it will tell you if you're correct or incorrect. So what that does is it just kind of gives you a feel about the exams, lets you move through the questions to see what kind of material we're asking about, and just gives you some idea. And if you do those questions and you've got any feedback for us or any questions about the questions, then obviously please drop us an email, and we'll get back to you.
Thank you. A question's just come in for Cordula. Do I need
Yes.
to pass all 3 exams to have the 1-year hands-on fellowship program?
Okay, so you don't have to take all 3 exams to have to be eligible for the 1-year hands-on fellowship program. However, I would like to say that hands-on fellowship program is a little difficult due to national regulations in the host countries. So it is only few host countries that actually can allow hands-on training in certain subspecialties. This will be Bangladesh, depending on the center. This will be China, depending on the center, and this will be India. Still, though, please be aware that the fellowship program, especially the 1-year fellowship program, is strongly competitive, and you can raise your chances by sitting the OF examinations. But of course, this cannot be a guarantee because it depends on how good your competitors are. But please feel encouraged to apply for it because it's always worth a try. Thank you. And if you fail and do not get an award for the 1-year program, you can reapply and start an application for the 3 months program. So there is always a good option to move on and enhance. So there is.
Thank you very much, Cordula.
One
more question. One more for you, Cordula.
Yeah.
Does the 1-year fellowship allow you to go home to see family in between?
Actually, you should discuss this with your host. Usually the host would allow you to go home to see your family for maybe a week or so, but not longer. And yes, be aware, please, that we cannot adjust your stipend according to another trip home during the fellowship program. Thank you.
Thank you very much. A question for you, Nicola. Are any further collaboration plans besides with Glasgow?
We're working in collaboration at the moment with COEXA, which I think is an important element of our process. And we've been working with them for several months now. We are gaining reciprocity with Glasgow, as I said. We're open to discussions with other organisations. We believe our exam is the highest possible standard. In fact, we know it is. Due to the people that are involved in it and the standard setting process, etc. And we would be happy to have the opportunity to offer reciprocity with other exams at the same standard. And we will, hopefully do that going forward. But our main priority at the moment is Glasgow.
Thank you very much. Rosie, back to you. That is the last of our questions. Thank you.
Thank you very much, Vicky, for facilitating that. And thank you, Nicola and Cordula, for answering so many questions.